And now to the new Omicron variant. White House officials saying today that there are currently no known cases of the new variant in the U.S., but they're advising Americans to stay vigilant.
We have the tools and surveillance in place to identify the Omicron variant. We also have the tools to prevent Omicron from increasing the strain on our society and our healthcare system.
Health officials say the best known defense against the new variant remains getting vaccinated.
We've said it over and over again, and it deserves repeating. If you're not vaccinated, get vaccinated. Get boosted if you are vaccinated.
Health officials also saying aside from getting the vaccine and booster, you can protect yourself by once again putting on your masks, social distancing, and avoiding crowds.
Facing a global spread of the Omicron variant, health officials are now preparing for a possible winter COVID surge. We have team coverage beginning with News 12's health reporter Shari Einhorn. She tells us what's being done tonight to deal with the potential looming threat.
You may recognize Elise Rubin. We spoke with her several times during the pandemic when visitors weren't allowed inside nursing homes.
Can you see the paper?
We all enjoyed the special window visits she had with her 90-year-old mother here at Gerwin Jewish in Comac.
State lifts nursing home visit limits.
Sadly, her mother passed away in September, but she's still coming here to visit her mother's best friends and is hoping that doesn't change.
You can't even explain how it feels inside your heart of how you cannot be with your loved one.
2 weeks ago, nursing home visitation guidelines were actually loosened and went back to what they were pre-pandemic. Yesterday, though, the governor said that could change.
This is as open as it has been. We are hopeful that the community that there is no community uptick and that it remains safe here. But we'll adapt. Again, that's what we've been doing for the last 2 years.
New COVID-19 protocols go into effect statewide on Friday. They're part of an executive order issued by the governor last week in direct response to the Omicron variant. The goal is to make sure hospitals can boost capacity if there's a sudden surge in cases. We reached out to health systems across the island. They say they're adequately staffed, have ample capacity, and can designate surge spaces if needed.
The chief medical officer for Northwell Health tells me concerns over the new variant don't change what the health system has already been doing.
We have plans all the time to be able to create new capacity, either because the census is below what 100% could be, or plans to increase it 5, 10 or more percent at any given day. That would take us literally hours to do.
On the Health Beat, I'm Shari Einhorn, News 12 Long Island.
Well, under the executive order, the Department of Health is allowed to limit elective procedures if a hospital or health system has limited capacity.